Chris Cugini, and you're watching Hospital Rounds here on Alliance Cable Channel 11. I'm here at Alliance Community Hospital this morning, and I'm so happy to be joined by Connie Altemeyer. She's the coordinator for the Diabetes Outpatient Education Program. Connie, thanks so much for having us today.
Thank you for having me.
I really appreciate it. I know this is such a important topic to talk about diabetes, because I know my great-grandmother, my mom, and my aunt all have, well, my great-grandmother has passed, but they all have type 2 diabetes. And so I know it's an issue that has plagued my family, and it's something that I always worry about because it seems to be generational sometimes, and so I'm worried about that. So I want to talk a little bit first about your role here at the Diabetes Outpatient Education Program.
Yes, I oversee the program for the diabetics, and I also oversee the program for the pre-diabetics. So we have actually two different programs going on at the same time. And we are accredited by the American Association of Diabetes Educators. And so that gives us, that recognition that we are keeping up with the standards.
So tell my viewers a little bit about what diabetes is, because I think there's some common misconceptions, because I know there's type 1, there's type 2, so just talk a little bit about that for me.
Okay. Well, in general, the 2014 statistics have come out, and they say that 29.1 million people have diabetes, and not all of them know they have the diabetes. About 8.1 million don't even know that they have it. They're walking around undiagnosed. So type 1 would be that child or young adult, but for the most part, the defining factor is their pancreas no longer works, and so they always have to have the insulin injection. The type 2 is more the one that you're talking about, that one that is hereditary. For those people, it's lifestyle intervention, as well as maybe sometimes taking some medication, either a pill form or an insulin injection. So those are probably the ones you see the most. 90% of the people are type 2s.
Do the symptoms differ between the two?
And for the most part, no. It's that increased thirst, always wanting to drink, running to the bathroom all the time, feeling tired. Maybe in a type 1, you're going to develop what we call diabetic ketoacidosis a little sooner than, say, somebody in type 2. So they may end up in the emergency room with these really, really high blood sugars, and they don't know why.
Sure. Well, see, that's why I always worried, like I said, because I've had this in my family, but, I drink a lot, and I don't know if that's always because I always drink a lot of water, like all day. I'll drink coffee, tea, and I'm like, I wonder if that's it, because I'm constantly thinking, is that it? And then, if I go to a bathroom a million times, and then, if I'm eating fatty foods, I'm thinking, do I have this? But I recently just went for my annual physical, and it was fine. My sugar levels were fine, blood pressure was good, so I'm like, okay, well, maybe it's not hit me yet, or maybe it's, because they were all older when they got it. They were all over 50 when they had found out they had type 2. So I don't, does age play a factor as well? Okay.
Yeah.
Why?
You will see, that's just how, as you get older, the body just doesn't quite keep up with the demand, so, yeah.
Maybe it doesn't just break down the sugar as well? Is that it?
Well, it's the pancreas making insulin.
Okay.
So the pancreas is the one that's not keeping up with
so
the factor.
So it might be slowing down a little more.
It might be slowing down. Or you're just eating more than what it can handle.
Than what you're supposed to. Okay, Well, talk a little bit about the classes. That's what we're here to talk about today. So what can people expect when they come to the classes here at Alliance Community Hospital?
Okay, our classes are a series of 4, and they're 2 hours each, so it's 8 hours of education.
Okay.
And it is by prescription, so you do need to have a doctor's order to come.
Okay.
And then once you have that order, we do an assessment with you one-on-one, and that usually involves myself and the dietitian. And then we do the classes, and like I said, there are 4 classes, and Beth, who is our dietitian, does one of the classes. So you do get a lot of education on that diet component, which seems to be a big concern to everybody.
Sure, and I know you had a prop here, and so I'm going to pull it down because I want the viewers to be able to see this. So tell us a little bit about what this is and what this is showing here.
This is just a demonstration of some of the sweets that you might be eating, say a donut, a piece of pie, and this is the fat content that you would find, yes, in those.
Connie, you're killing me. I don't think I would ever, I feel like if I had this with me every day, that I would never, ever eat anything ever again, because that's just, it's just gross, because I think you know, I was telling you off camera, you know, like I had the donut the other day, and I'm like, I see that, and I'm like, oh my gosh, you know, what did I just put into my body? So I think you know, it's good that the people will be learning at these classes, you know, what to and what not to put in their body, and the harmful effects that it could have for you. So I know you have an upcoming seminar, so I wanted to know if you could talk a little bit about that. And
Okay, our seminar is Saturday, November 8th, here at the Alliance Community Hospital. It starts at 9, and we do like people to register just to let us know how many might be coming. And we have a physician who will be coming to speak as well.
And I know you also have these group meetings, and I think it's great that you have these classes, you have the seminars, and then you have these group meetings to kind of help people through this, because I know when my mom first got the diagnosis, we were actually on vacation, and she just started not feeling well and went to the doctor, and when they did the blood work on her, she found out that she had type 2. And so she just, I mean, it was from that day on, and she still has a hard time with it now. And, you know, it's hard for my dad and I, because my mom we're Italian. You could tell by my last name. And so she's very stubborn. And so my dad's always afraid to tell her what she can eat. I'm like, Mom, do not have that ice cream. Mom, do not have that donut. I'm like, Mom, you got to watch, you know, how much sugar you're taking in, because I worry, you know. But she has done really well, and she's actually lost a lot of weight, which I'm really happy about. I think within the last year, she's lost like 30 pounds, close to it. So it's been good for her, because she's been active more. She's been watching what she's eating and what she's putting in her body. But I know it's hard. So at these group meetings, what do people talk about, and maybe what does the hospital help them with?
At the support group meetings, we try to have a topic or a speaker come in. Sometimes it's me.
Okay.
But we just try to address those lifestyle interventions. Healthy eating, being active. Sometimes we even address the emotional parts of it, you know, the depression. We look at the newest meds that might be out there. So just different things that might help them through their daily lives to handle it better.
Well, perfect.
Make better decisions.
Absolutely. And I hope people do make better decisions, because this is something that really can affect your life. And if you do it the right way, you can change your life for the better. So Connie Altmeyer, thank you so much for having us here today and sharing all this wonderful information and scaring me half to death with all the fatty foods in there. I appreciate it.
Well, thank you for coming.
Thank you. I'm Chris Cugini. You're watching Hospital Rounds here on Alliance Cable Channel 11.